So we are talking about a classification which also serves as what you trying to talk about the types of abnormal uterine bleeding. Okay, the classification is more of like you're talking about the types. So for the classification of abnormal uterine bleeding, that's of course bleeding that is not menstruation. All right. So classification is based on a mnemonic, which is very, very popular amongst medical students. And that mnemonic splits the causes or types or classification of abnormal uterine bleeding into structural causes and non-structural causes. The structural causes are abbreviated under PALM, while the non-structural ones are the COEIN. Okay, so you have the PALM COEIN, right? So for the structural causes, the mnemonic is PALM, right? So the P is polyps. So polyps, you have all those benign growths, all those, polyps. Adenomyosis is a condition where the endometrial tissues grow into the muscular walls of the uterus. That means the endometrial tissue is not found in the endometrium, but is found in a different location. Leiomyoma is also known as fibroids. Okay, they are non-cancerous tumors of the uterus. They distort the uterine cavity. Then the M is malignancies, or you can say tissues growing outside their boundaries. Okay. Then for non-structural causes is the abbreviating known as a COEIN. So somebody can be bleeding from the uterus simply because they have issues that have to do with their blood will not be clotting quick. Do you understand? So it's not a structural issue. Like von Willebrand disease can lead to excessive bleeding generally in the body. Of course, you can also have bleedings in the uterus. Ovulatory dysfunctions like the polycystic ovarian syndrome, the thyroid disorders, endometrial causes like disorders of the endometrial lining. It can be infections, it could be inflammations, and the rest of them. Then iatrogenic, that one is caused by what? A surgery, like a complication of a surgery, right? Then we have the N, which is also known as what? Not yet classified, okay, or poorly understood causes. Okay, so that's a classification of types